Hey everybody, how y'all doing? It is Self-Care Sunday, and I am Madam CJ, your host. All right. How y'all doing? Now, let's get right into it. September is Sexual Health Awareness Month, and it is also Perimenopause Awareness Month. And if you are 18 and up, this video is for you. If you are below the age of 18, you need to have a parent's permission, or you need to have your parent or guardian here with you watching this video. Now that we got that out the way, I want to share some things with you. I follow and listen to this woman by the name of Dr. Aviva Romm. She is a Yale medical she graduated from Yale Medical School. So she has a medical degree from Yale, but she's also a midwife and she's also an herbalist. And we at Divine Clementine Bath and Body love herbs. We use herbs. We love midwives because my great great grandmother was a midwife, and the midwife was here before medical doctors came into play. Okay. The medical doctor was basically created to push the midwife out. So, for Dr. Aviva Romm to be a medical doctor who graduated from Yale, also for her to be a midwife and an herbalist, she is a friend of the woman. Okay, she is a friend of the womb, and we can trust her with her word. Now, I am going to share a few of her points. She has a post that she created on Instagram called "What I Wish Women in Their 20s, 30s, and 40s Knew to Make Perimenopause and Menopause Easier." I'm going to share a few points today, and then for the remainder of the month, I'll be sharing on Sunday the rest of the points, but I'm not going to share all of them today. Um, I will let you all know this though. The points that she has made in this post, which is about 8 points, I've noticed that if these points are applied to when you start your menstrual cycle regularly, if you have fibroids, and entering into perimenopause and menopause, all three of these phases of life or symptoms of life, being a woman and dealing with the female reproductive system, they all work the same in each area of life. So if you want to have a pain-free period, if you want to have symptom-free fibroids, or if you want to have minimized or a symptom-free perimenopause and menopause transition, do these things. They're pretty much universal. So one of the first things that I noticed that she talks about, she says, take care of your pelvic floor, especially if you've had babies vaginally. Not only does it prevent later pee leaking problems, but it can increase your body awareness and sexual satisfaction. Now, one of the symptoms that I had dealing with before I had this myomectomy, getting rid of 37 fibroids, one of the symptoms for the fibroids that I had was incontinence. They used to sit on my bladder. So what I did was I bought me a yoni steam seat and I started steaming my vulva, my vagina, my womb. I did this for 28 days consistently because that is what I was told to do because I have fibroids. And within those 28 days, the symptom of incontinence disappeared. I stopped basically having pee leaking problems due to fibroids sitting on my bladder. Also, there is a sensual floor work methodology that I teach at Vertical Joe's called Liquid Motion. And basically what it is it is a sensual floor work methodology where all the movements initiate from the pelvis. So we are tilting and tucking our pelvis to initiate all the movements. And I have some Instagram videos that I've shared that shows the movements. This floor work methodology is very powerful because I noticed that after the day after my myomectomy surgery, though I had on an abdominal binder, I was still able to sit up. When I took it off the third day, I was still able to sit up on my own. This is due to me doing and practicing liquid motion, being committed to that practice and doing it consistently from 2020 up until a few months before I went into my surgery this year. Okay. So we have to make sure that we're doing pelvic floor exercises. And I'm not talking about squeezing the kegels because a super tight vagina is not always the way to go. And the vagina rehab doctor, who's a pelvic floor therapist, talks about this. A super tight vagina is for male's pleasure. It is not healthy for a female bodied woman or female bodied person to be having a tight vagina. It's not your friend. Okay? More on that. You can check that out on the Vagina Rehab Doctors on Instagram page. Okay? So, also, she says that if you need to regulate your nervous system. The stress you plow through now can affect your cortisol and your hormones in lasting ways, from metabolic issues like weight gain and high cholesterol to depression, poor sleep, brain fog. Learning to heal trauma, self-regulate, find calm now can prevent or help you weather menopausal mood and sleep storms later. Now I'm going to tell y'all this. I learned how to regulate my nervous system through my spiritual practice and also through my movement practice. Those are two things. Actually three things. I started doing strategic self-care in 2017, but that is how I keep up with what it is and document what it is that I need for my own self-care, my own intentional wellness. So with my spiritual practice, I chant Nam Myoho Renge Kyo, which is an active form of meditation. It has helped ground me and keep me out of trouble since 2012. Okay? Y'all know Tina Turner used to chant Nam Myoho Renge Kyo when she was alive. And you all see how her life changed and how much victory she received in her life. But we do have to have some type of practice that grounds our emotions, that helps us spiritually, that helps us with our emotional hygiene. And chanting Nam Myoho Renge Kyo and being a Nichiren Buddhist helps me with that. Okay. Also, movement, the movement practice that I have, that I'm committed to. I hate the gym. I hate the gym. And Aviva Romm, Dr. Aviva Romm, she talks about strength training. And it isn't about weight. It's about strength, fitness, bones, grit, resilience. Your muscles and your bones and your heart need this foundation as you move through life. It will help keep you stronger, which means you'll have a longer lifespan, healthier lifespan, and independent living. Okay. Strength training can be pole dancing. It does not have to mean you go to the gym and you are lifting weights and doing things you're not really excited about doing. I love pole dancing. I love liquid motion because I still look like a woman when I'm, on that pole. And after I get off that pole, I like the way my body looks. With liquid motion, I'm lifting my own body weight, and I weigh 106. So those forms of sensual dance fitness are excellent for pelvic floor health, excellent for strength training, and you don't have to worry about going inside a stinky gym and being harassed by folks you don't want to be harassed by. So anyway, I'm going to share just those three things today that I just shared. One more thing. If you all are concerned about having a pain-free period, or you have a painful period, you have fibroids, or you're having very symptomatic menopause, you cannot eat little girl snacks. You cannot dine on coffee. You cannot dine on caffeine and think you're not going to have symptoms of fibroids, painful menstrual cycle, or symptomatic menopause or perimenopause. If you're eating little girl snacks and you're drinking coffee all day, you're starting your day with coffee, you have to know that you are setting yourself up for failure. You're setting yourself up for pain. You're setting yourself up to have symptoms of night sweats, dry vagina. This is menopause. And other things. Processed food is never good for the female reproductive system. Also, the blood type diet. Dr. Aviva Romm does not talk about the blood type diet, but I talk about the blood type diet and how much it has benefited me in my relationship for me having pain-free period, pain-free fibroids, and symptom-free perimenopause. Okay, so I'm gonna come back next week and talk to you more about what I wish women in their 20s, 30s, and 40s knew to make perimenopause and menopause better. Her name is Dr. Aviva Romm. If you want to go and search her out, it is spelled Aviva Romm. Okay. Thank you so much for watching. I hope this helps. And happy Sexual Health Awareness Month and Perimenopause Awareness Month. Peace.